Today, thankfully, we are here with a very different mission. We are here to support a worthy cause, right? Not long ago, we got two requests, and they came one after the other. We got the first request from the intensive care unit to help support the emergency equipment that should drive the intensive care unit, to help improve healthcare at the unit. And then we got the second request that came from the pediatric oncology unit. Is that right? You know, you have to mention it right so you don't get it wrong. And that unit is responsible for taking care of children undergoing cancer treatment. There were some people who actually pursued and followed up and made sure that we have heard the story of why they need and why they need to support. I've got one, Mr. Stephen Ayepedison. He was relentless in his follow-ups, providing compelling justifications for why we need to buy the ICU equipment, right? And the oncology unit also had their own formidable advocate, and that came through the Lifeline for Childhood Cancer Ghana. That was led by Madam Ekwia Sapon. We are donating today ventilators, patient monitors, blood gas analyzers with cartridges to support diagnostics and critical care at the ICU, while we're also donating patient monitors for the pediatric oncology unit, all of which are valued around 2 million Ghana cedis. And while you clap to the 2 million, the bigger value of what we are doing today is much more than the money, and it's much more than the equipment itself. It's our lives and the opportunity to help save lives, the opportunity to help strengthen healthcare, and the opportunity to help show something different in the healthcare space. And also, Newmont as well, we have a responsibility as a corporate entity to work towards a society where quality healthcare is available. We can't solve all, but we have a responsibility to support and help improve healthcare, and that's what we are doing today. Many Ghanaians from all over the country would have had interactions with this hospital. I know that it's a significant reference point for even West Africa as well. I have had my own personal encounters with the hospital, and very good encounters. I've had very good encounters with the hospital. At the same time, we also acknowledge that sometimes the equipment availability can be a challenge on allowing the hospital to deliver its full potential. There's absolutely no doubt about the quality of personnel, the quality of professional personnel in this hospital. I think when you look around Africa, West Africa, Ghana, this is a reference point, right? People come here, and you can clap to that. This is a significant reference point. And that means we must all put our hands together to try and support with equipment that can actually make that professional expertise deliver more. And we're very happy to be here with that. We have been, and when I say we, I mean Newmont, we've been a significant contributor in the healthcare delivery space over the years. We have constructed health facilities. We have provided critical support for existing facilities, whilst we also facilitate capacity building for health professionals across the country. The Intotrosu College of Nursing, which was established in 2014, was established by Newmont through the Newmont Foundation. And that has provided a lot of training for professionals that are supporting medical healthcare across the country. We also have a long-standing partnership with Project Cure, which ensures delivery of medical equipment to health facilities across Ghana, as well as transfer of knowledge to medical professionals. So such partnerships, including the one we're doing with Korle today, is very important and provides a long-term support for the development of healthcare in the country. We see beyond Korle, and we see a significant support to help Ghana improve its healthcare. At this point, I would like to express Newmont's deepest appreciation to the doctors, and I would express also my personal appreciation. I told you that I've had a personal encounter with Korle, very, very positive encounters. So on behalf of Newmont, we would like to appreciate the doctors, the nurses, the other healthcare professionals that work in Korle, including the administrative staff because sometimes we forget that behind that medical delivery is a very strong administrative network that is supporting them. So we would like to express our appreciation to that. It's not easy to work through sometimes the challenges and the difficulties you have. And I can only encourage you to keep driving and keep going in that space. It is our hope that the equipment will make your work a little easier. It is our hope that equipment will help improve patient outcomes in Korle, and also improve the hospital's ability to save lives. And I know that you have so many units within the hospital that would potentially have need and demand for some of these equipment. It is our hope and desire that this equipment will continue to stay within the units that are going into now. And in a year or two, a few years time when we come around, we will be very happy to see that. We will continue collaboration with Korle because it's important. And I wish you all the best. And I take this opportunity also to say a very happy new year to all of you. And thank you for welcoming us. Thank you for the opportunity to actually serve and support Korle. Thank you.
We want to welcome Newmont Ghana to Korle Teaching Hospital. Today they came with very good news. They came to our aid at the time we needed it most. They have donated generously. Like he mentioned earlier on, the Department of Anesthesia and Neurosurgical Department, no matter what we do, the number of patients coming into the intensive care is overwhelming. And the surgeries that are done at neurosurgery sometimes is determined by space that we have at the intensive care. Because most of the surgeries that are done at neurosurgery invariably ends up at intensive care. So if we don't have space to accommodate them, we are not able to operate. Not only that, we have a lot of influx from maternity. Our ladies come to deliver, and you never know. Sometimes it leads to complications, and before you realize, the patient moved to intensive care. So the equipment they have donated today, no value. You cannot put a value on it. It has come at the right time. The ventilators, the monitors, and all that is coming to take care of our intensive care unit. Apart from that, we also have childhood cancers that we are dealing with. And it's enormous. You need the monitors to monitor. We also have the pediatric intensive care unit that we are doing everything in our power to ensure that we give world-class health care to Ghanaians. And that is our landmark. Like Director mentioned earlier, we have the best human capital when it comes to healthcare in the country, if not West Africa, and we are among the best when it comes to Sub-Saharan Africa. Our human resource capacity is unmatched. So on this note, I want to thank Newmont Ghana, the board of directors, management, and the entire staff, and all those who have made it here to support us today. We are very grateful and will remain grateful. Like you mentioned earlier, this thing has no end. We'll continue to knock. And at the right time, we'll also come to show our appreciation more. So we are very grateful to Newmont Ghana.